Hello and welcome to EduSeries, Fertility Awareness-based Methods in Your Practice. This is Ann Mullen from Cycle Technologies, and I am here with my guests. Before I introduce them, I would like to let the people who are listening to us know that they are muted, so you cannot hear each other and we cannot hear you. During the presentation, if you have questions, please go ahead and enter them in the question box and hit submit, and we will take your questions at the end of the webinar. We are going to try to keep this to 45 minutes so everyone will be able to go on with the rest of their scheduled day. So now I would like to introduce my guest today. I have with me Dr. Victoria Jennings from the Institute for Reproductive Health at Georgetown University. Hello, Dr. Jennings.
Hello, Ann. Thank you so much for having me today.
Thank you for being here. And I also have with me Dr. Marguerite Duane. She is a family physician, and she's also the co-founder of FACS, which is the Fertility Appreciation Collaborative to teach the systems. Hello, Dr. Duane.
Hi, Ann. I'm delighted to be here.
Yeah, thank you very much, both of you, for being here. And I was very excited that you could both be here because you have deep experience and expertise in fertility awareness methods, but from different perspectives. Dr. Jennings, you are the director of the Institute and have actually researched and developed methods. Could you maybe just tell us a little bit about the methods, or tell us which ones they are?
Sure. I would be glad to, Ann. Thank you. In fact, I think the ones that we'll be discussing today, the Standard Days Method and the TwoDay Method, are both methods that we at the Institute for Reproductive Health at Georgetown have developed, tested, and supported through technical assistance the rollout in various countries around the world. Our motivation has really been to come in on the end of the spectrum of fertility awareness methods that are very simple for people to use, very easy to teach and learn, and that can be easily adapted to a variety of circumstances, particularly in developing countries, because much of our research has been supported by the U.S. Agency for International Development. The needs of a developing country or a very low resource setting have been very uppermost in our minds. Of course, we think about effectiveness, we think about many things when we think about a fertility awareness method, but I think that's really what's driven us in terms of the types of fertility awareness methods that we have been dealing with.
Yes, and we'll look forward to talking about those methods in detail, and the interesting point that not just in the developing world, but women even here in the U.S. and in Europe are very interested in these methods as well. I'm also very excited to have Dr. Duane here. As a family physician, you've been able to implement these methods in general practice.
Correct, Ann. As a family physician, I've used these methods, offered them to my patients, many of whom actually are of low literacy or come from a lower socioeconomic class, which I think disputes the myth that these methods are only available for well-educated women and couples. More importantly, I also teach about these methods to medical students. In 2010, I taught a course to first-year medical students at Georgetown, and that experience inspired me to co-found FACS with another family physician colleague. At FACS, our mission is to educate physicians and other healthcare professionals about the evidence that are used to support fertility awareness-based methods, methods that have strong evidence for effectiveness and for use not only for family planning but also to address common women's health issues. So our goal is to educate the healthcare professionals so they can in turn educate and empower women and engage men back in the conversation of family planning.
Mm-hmm. And we will send out information on FACS and other resources to the participants of the webinar. So I would like to go ahead and talk about our goals for this webinar. One of the things that we would like to do is simply be able to have everyone define what is a fertility awareness method. And we would like to talk about the efficacy and the fact that these have been scientifically tested, the ones that we're going to be talking about. They've been vetted, and that you can be confident that this is something that is viable for your patients. We would like to talk about the full range, including them in a full range of contraceptive options, And finally, as I mentioned, we would like to let people know the resources that they can access and find out more information. So first of all, let's talk about what is a fertility awareness method. I have here, it is an effective way for a woman to track her menstrual cycle and observe fertility signs, and then use specific rules or protocol to identify the days she could become pregnant. But Dr. Jennings, maybe you could tell us a little bit about what a fertility awareness method is based on as far as the physiology of the woman and how these methods then were developed.
Well, I think it's just at the basis of it that fertility awareness-based methods are considered really part of a patient's natural fertility cycle. She keeps track of the first days of her period, and she observes fertility signs and symptoms throughout. Which fertility signs and symptoms she observes, how she observes them, etc. That's based in a sense on the method per se that she's using, on the method that she's following. But she uses the rules of the method that she's using. She identifies the days that she could become pregnant if she has unprotected intercourse. That is what is common, I think, to all of the fertility awareness-based methods.
Mm-hmm. Well, speaking then about knowing when you can become pregnant, then these are basically the ways that these methods can be used. So they're kind of multi-use. First of all, of course, a woman can avoid an unplanned pregnancy by either abstaining or using a barrier method such as a condom during the days that she identifies as fertile. Secondly, another popular way is for women who want to become pregnant. So trying to conceive is a reason for using fertility awareness-based methods. And finally, some women simply like to track their cycles and know what's going on. Dr. Duane, I know that you talk about other reasons for using a fertility awareness method. Maybe you could mention a couple about in the couple dynamic, for example.
Sure. I think you've highlighted some key points. These really are true family planning methods that can be used to avoid or achieve pregnancy. These can be very empowering for women because by tracking her cycle, she has a much better understanding of her body, her cycle, her moods, and it really helps in a couple relationship. These methods do require two people to participate. A woman needs to communicate to her partner when she may or may not be fertile, and this is going to result in a conversation on a monthly basis about their family planning goals. Being able to have regular conversations communicating about the woman's body can really help to improve the communication between a couple and help to strengthen that relationship, certainly. The other way that these methods can be used is when you have physicians or other healthcare professionals that have additional training in the use of these methods. The cycle, a woman's menstrual cycle, is almost like a fifth vital sign. If a woman can come in with a chart or with information about the length of her cycles or about her cervical mucus, a physician or specially trained healthcare professional may be able to identify health issues that may be affecting a woman's fertility. Many people may not realize it, but women are only fertile for about 3 to 6 days out of their cycle. And there are key biomarkers or signals that a woman can observe. If those aren't present, again, specially trained healthcare professionals can work with a woman, work with a couple to help address potentially underlying causes of infertility or polycystic ovarian syndrome to help make a woman's menstrual cycle healthy. Again, it's a normal part of her reproductive physiology, and we should, as physicians, we should do everything we can to support the good health of women.
So it sounds like just beyond the regular family planning, there's just health reasons that a woman might be interested in using these methods.
Right, absolutely, and that's why I prefer to use the term fertility awareness-based methods as opposed to natural family planning, because while natural family planning emphasizes that these are natural methods, there's no hormones, there's no artificial drugs or devices that a woman may be using and subjecting herself to unnecessary side effects, fertility awareness-based methods really emphasize it's more than just family planning. It's really about supporting a woman's health. And I personally believe these methods should be taught to all women, frankly, at a very young age, you know, when they're first starting to cycle, so they can begin to understand what's normal and what's not. Because I think it's very, very empowering for women when they have a sense as to their cycle.
I completely agree with that, Dr. Duane. I think that that's just so critical for all women to understand. And it's so interesting to me how interested young girls, when they're just going, just at the point of menarche, just when they're in puberty, how interested they are. How open they are to this information. It's very non-threatening information to them. It's very exciting for them. And the numbers of programs around the world that are working with young girls that really help them understand their fertility, I think it's very, very interesting to see this. So I could see this really, whether a person is taught this as a method, as in a method for preventing or achieving pregnancy at a particular time in your life, regardless of that, of whether that may or may not be appropriate for someone at a very young age. But for an 11, 12-year-old girl to really understand her body and what all is going on. What is that white stuff I see in my underwear once a month? Am I sick? What's wrong with me? Why do I have these cramps? All of these things are things that she does not get from what is unfortunately called a sex education class at her school. Mm-hmm. But this is really what people need to know.
Absolutely.
Well, it sounds like very good information, whether or not a young girl or a woman uses it for her family planning or her birth control option at a certain point. But she's empowered, it sounds like, what you're trying to say.
Absolutely.
Well, I guess that kind of goes on to my next question about why include fertility awareness-based methods in a practice, or why even include them in counseling at all. One of the things that we found in some of the recent reports from the CDC is that women are interested in them. The University of Iowa back in 2008 did a study on fertility awareness methods, and with the women that were in the study, they found that 1 in 5 of the women were interested in using a fertility awareness-based method for their method of birth control when they received positive information about it. And Dr. Duane, I don't know if you can speak to that with your experience?
Yes, certainly. I think that these findings replicate what was found in an earlier study that was done in a population of a couple thousand women who were going to get their driver's license renewed. They were briefly told about natural methods of family planning and asked if they would be interested. And again, about 20% said they would be interested in learning these methods to avoid pregnancy. Almost 40% wanted to learn about them to help achieve pregnancy. Just recently, there's been another study in the Hispanic population, and the percentages of women, Hispanic women who are interested, were much, much higher. Approaching 50% would be interested in learning these methods to avoid or achieve pregnancy. So clearly the interest is there. So it's critical that as healthcare professionals, we are knowledgeable so that we can offer these methods to our patients who are looking at this for either a family planning option or as a method to monitor their reproductive health.
And so that they can make the choice of what they think is best for them. Another interesting thing that came out in the CDC report, and I'm not quite sure what this says, but they reported that educated women in particular were interested in these methods. So about 40% of highly educated women had at some point tried or used a fertility awareness method or calendar-based method for their birth control. Now, Dr. Duane, you had mentioned to me at one point that you thought that this might be sort of a biased view of looking at these methods.
Yeah, certainly. I think the myth is that these methods are really only available for well-educated women, but as Dr. Jennings has pointed out, many of these methods can be simplified and taught to women of all ages, from different literacy levels and different education levels. In my own practice here in the Washington, D.C. area, we serve an almost exclusively uninsured, poor, illiterate population, and we were able to use these methods to teach couples how to chart their fertility. In many instances, these couples were looking to achieve pregnancy. But the bottom line is that we're teaching a woman basically how her body works. Women can be empowered, and as healthcare professionals, again, I think we need to be careful not to presume that a woman doesn't have the knowledge. We need to empower them and give them the basic information. The other point I would make is I think it is critical for women to learn these methods from someone with training who can teach these methods. That may or may not be the physician or the healthcare professional, but a trained fertility awareness-based method educator or natural family planning educator. So I think we're seeing more educated women using it because they can avail themselves of the teaching.
So you think that maybe because they may have heard about it, or
they may have heard about
it.
They may have heard about it. Unfortunately, these methods, although they can be used for family planning to avoid pregnancy, they're not covered under the HHS mandate. So if a poor person is looking for a family planning method and her resources are limited, she may not even be offered this as an option because her insurance would not necessarily cover it.
Well, maybe that's something we'll talk about later on in the webinar.
I think it is important, particularly here in the United States, but I do just want to point out that it's really been shown that women all over the world, regardless of their educational status, are interested in and quite capable of using fertility awareness-based methods. It's a question of how they're presented and sort of how they're contextualized. So I think it's very critical to think about, but if we just think for a moment about why it is that women don't use any family planning method, even though they would like not to get pregnant right away, for most of them it is fear of side effects. For many it is a misperception of their own fertility. They think, oh, I won't get pregnant. I had sex twice last month. I didn't get pregnant. Therefore, I must be that I can't get pregnant. So there's a whole lot of misperception here that can be addressed by these methods, and it's really just a matter of appropriate presentation. We talk about the numbers of women who are interested in these methods, and then we think about, all right, but here in the U.S., for example, the percentage of women who are actually using them, and I think you'll agree, Dr. Duane, is really quite low. So if people are interested, why aren't they using them? And I think quite often if you look at the way family planning methods are presented by health providers, it is really quite astonishing. The low esteem quite often in which, or the negative views that many have about fertility awareness-based methods, and it really affects what their patients are wanting to use.
Yeah, and I think that's a really good point, and that takes me further to these reasons why women do choose fertility awareness-based methods. And Dr. Jennings, you mentioned, for example, that it addresses reasons why people have unplanned pregnancies. Like you said, some women perceive that they can't get pregnant, or they experience side effects. Another reason is that some people do know that these can be very effective methods. And another point that I would like to touch on also later in the webinar is that they're becoming easier to use with the advent of smartphone apps and that sort of tool. And then there is just a bonus to having a range of contraceptive methods available to patients, which Dr. Duane had mentioned before. So I'd like to go on and actually talk about the methods themselves. So which are the proven or scientifically tested fertility awareness-based methods? So I have 5 listed here. They are the Ovulation Method, which was, I think, the first or one of the first methods that was developed. The Sympto-Thermal Method, the Sympto-Hormonal Method, which is a little bit newer as well, and then the two that Dr. Jennings, you spoke of, the 2-Day Method and the Standard Days Method. So let's look at each of these in a bit of detail. The first one, the Ovulation Method. Dr. Duane, I know that you have worked a lot with these methods. Maybe you can explain in a bit of detail on what this chart is with the Ovulation Method.
Sure, certainly. The Ovulation Method was originally first developed in the 1960s by Drs. John and Evelyn Billings from Australia. This physician couple were able to observe that women can note their cervical secretions to identify when they're fertile and when they're not. Women, when they're taught this method, and this method has been, there are variations of it. There's Billings and Creighton and Family of the Americas, but with this method, women are taught to observe for cervical secretions or the sensation of moisture at the opening to the vulva. They're encouraged to monitor their cervical secretions on a daily basis, assess the quality and quantity of the secretions, and then record their observations on the chart. And in this chart here, what we see is that in the first 3 days, a woman has used red stamps to indicate she's had her menses. She had a dry day on the 4th day where she didn't note any mucus. On day 5, she actually noticed some cervical secretions, and so she uses a white baby stamp to indicate this may be a potential day of fertility. As you can see in the notes, where she writes down her description of the secretions, the mucus over this 5 to 6 day period tends to become more copious, more lubricative, more stretchy. The most fertile type mucus is what we describe as an egg white type mucus, and then it looks like raw egg white, and it's very stretchy, clear, and transparent. Once the woman has hit this last day of what we call her peak type mucus, under the influence of progesterone, then the cervical mucus will dry up, and women will note a distinct difference from their fertile type mucus to a drier sensation and sometimes complete drying up of the mucus entirely. If couples are looking to use this method to avoid pregnancy, almost all of the studies to date have been done in the ovulation method with couples abstaining during the fertile window. If couples choose to use condoms, they're certainly welcome to do so, but they may be at slightly higher risk for an unintended pregnancy. They can use this method they can have intercourse to avoid pregnancy, they would avoid intercourse during menses and during all days with secretions. And then, as I mentioned, that peak day, we know that ovulation occurs within 2 days of peak, either plus or minus. Therefore, because we know the egg survives for up to 12 to 24 hours, we encourage women to abstain or avoid unprotected intercourse for 3 days past the peak. Once they're past 4 days past their peak day, they've entered into their second infertile phase. I tell my patients, you can have sex all day, every day. There's no way you're going to conceive, because once the egg is gone, you're not going to have another egg for another month. So there's quite a lot of opportunity for couples to have sexual relations using these methods. I think another misconception is that people that use these methods can never have sex. In reality, we find that couples that use natural methods have sex as often, if not more often, than couples that use artificial methods. They just time it differently depending on their intentions.
So, and with the ovulation method there on this chart, the woman has the coding, and she looks at the chart and determines by the codes that she's put on
By her
chart.
own observations.
Okay.
I do think it's important, because we're looking here at the screen with a particular type of chart on it, that different programs that teach the ovulation method use different types of charting systems. So they don't necessarily all have white stamps with babies on them. But they may have some other symbol that indicates that this is a fertile day. So it's important for people who are listening to this webinar to not think that in order to teach this method in their program that they have to have something that looks exactly like this. There are many examples at the Institute for Reproductive Health. We have some samples on our website, and so do many other programs that can offer options for this type of charting.
I think the key is when you learn a method and you learn the charting system, you stick with that method and you don't try and mix and match methods.
Right, exactly.
Exactly.
So the next method to take a look at is the Sympto-Thermal Method, and this adds another fertility sign to the secretions that a woman observes. So again, Dr. Duane, could you explain to us what a woman is looking for and how she would then record these symptoms?
Certainly. The Sympto-Thermal Method is one of the most effective methods out there, with typical and correct use rates well above 95%. With these methods, again, women are going to be taught to observe for cervical secretions. When they notice the onset of cervical secretions, they will be able to identify the beginning of their fertile window. They will also record their basal body temperature, and this is important. They'll do this every morning at the same time every morning when they first wake up. The reason why they check their basal body temperature is that the basal body temperature will rise about 0.4 degrees Fahrenheit around the time of ovulation and remain elevated. And this is due to the influence of the hormone of progesterone. The temperature, again, will remain elevated through the end of the cycle. Once a woman notes her temperature is up for 3 consecutive days, she will note that ovulation has already occurred, and again, she's in that second infertile window in which she's not able to conceive. Again, women can use charts to record this, apps. Depending on the teaching organization, the charts may look different. Similar to the cervical mucus methods, if couples want to prevent pregnancy, they would abstain or use condom use during their menses, during all days with secretions, during the next pre-ovulatory day after having intercourse on a pre-ovulatory day. The reason being is if ovulation has not occurred, a woman has sex, she may have seminal fluid residual. She may not be able to distinguish that between her own cervical secretions. But then again, once her basal body temperature has been elevated for 3 consecutive days, she's then into phase 3 of her cycle. A couple can have sex all day, every day. Once the egg is gone, there's no chance of conceiving.
And I think that's also an interesting point, because a number of women that I've spoken with either thought, or when they were younger they were told, there was a risk every day of the month. And I think that's maybe an important thing to think about when you're talking or consulting patients.
Absolutely, and as I mentioned, women are actually only fertile for about 3 to 6 days out of the month. And the reason that is that in order to make a baby, you need an egg from the woman, a sperm from the man, and fertile cervical mucus. I mentioned earlier that the egg can survive for 12 to 24 hours. Sperm, in the presence of fertile cervical fluid, can survive for up to 3 to 5 days in a woman's reproductive tract. So if a couple has intercourse 5 days prior to ovulation and there's fertile cervical mucus present, the sperm can survive for that 5-day period. Once a woman has ovulated and the egg is released, that egg will only survive for up to 12 to 24 hours. So you get that 6-day window. Outside of that window, a woman cannot become pregnant. And this is important not only for couples trying to avoid pregnancy, but for couples trying to achieve, because we think getting pregnant is so easy, but it's really not. You really need to be able to identify that period of fertility.
So it's in the timing.
I think that's what these methods are all about, is being able to identify that period of fertility. That's precisely what we're all about here. Trying to help, to devise approaches that will help women easily identify that window of fertility as closely as possible, realizing that there is variation in cycle length, there's variation in the onset of cervical secretions, the duration of cervical secretions. That's true. So there are quite a few variables here, and that you want to be conservative enough that the woman is able to avoid pregnancy if that's what she wants.
Exactly.
So it's quite often it seems like we extend that fertile window unnecessarily, but it is necessary to help the woman achieve what she wants to achieve.
Right. Yeah. I think that's a great point, because even though women are only fertile for 6 days, the period when they need to consider themselves potentially fertile is typically longer. It's typically, correct me if I'm wrong, Dr. Jennings, but about 10 to 12 days depending on the method. So
Right.
that is important to note. And again, as Dr. Jennings mentioned, you want to be a little bit more conservative if a couple has very strong reasons for trying to avoid a pregnancy.
And I guess I would mention too that these first two methods, the ovulation and Sympto-Thermal Method, they do take a bit of training. So,
Absolutely.
and we again will have resources for the interested providers. We'll send out an email.
As does the next method, the Sympto-Hormonal Method, which, again, like the Sympto-Thermal Method, you're looking at 2 observations. You're going to observe cervical secretions for the onset of the fertile cervical window, as well as women will use the clear blue fertility monitor to check their urinary hormones every morning. This test will test for estrogen metabolites so they can note the onset of their fertility or their fertile window once they detect estrogen in the urine. And then it will also check for the luteinizing hormone, which is what causes the release of the egg. So women will use the monitor to detect not only the beginning of their fertile window, but when they've ovulated or when they're about to ovulate. And then again, continuing to observe cervical secretions to identify the end. Optionally, they can use basal body temperature as well, but that's not necessary. And again, you would record these observations on a chart or using the monitor. The nice thing about this method, and as you pointed out, Ann, with these methods, it's really important to learn from trained instructors. With the Sympto-Hormonal Method, the best known of which is the Marguerite Method, Marguerite offers teaching of these methods online with trained nurses. So it's a great option for people that may not have local
so that's convenient.
choices.
Yeah, so
yes.
you would have some. So that is, I'll mention here, I have up on the screen the Sympto-Hormonal Method. That would be the third method that we're speaking about. And from my understanding, it is the newer of
Yes.
these.
Yes, this was originally developed in the 1990s, again, working off of the research that had been done to develop the ovulation methods as well as the Sympto-Thermal methods. Dr. Richard Ferring at Marquette University worked with his colleagues to develop this method. And it's also probably one of the best researched methods. They've not only researched it from in women, regular women, but also in women using this in the postpartum period.
And would you say, and I'm not as familiar with this method, is it introducing this device, is it easier to use, or is it more accurate, or what's the difference here?
So I think that part of why they introduced the device is it actually helps to narrow down that window of fertility when couples need to avoid pregnancy. As a result, actually the effectiveness might be a little bit less, but it's very appealing to women who are looking for that clear double check, because it's not a woman having to rely on, well, I think this might be this kind of mucus. It's when you check your urinary hormone, it tells you.
You see the level.
You see the level right there. So it's a nice objective secondary check for women to feel that higher level of confidence that they have a good sense as to when they're fertile and when they're not.
So in general then, to prevent pregnancy, I have some general guidelines here, but could you speak to, is this the accurate way that a woman identifies?
Yes, the challenge is you don't know when your peak day is going to be, so you can't say it's peak day -6, but on average it's typically about 6 days prior to peak day. But you're going to look for the presence of the estrogen hormone, which will be detected, and the monitor will read H for high, or the presence of cervical mucus. So as soon as you see or sense any cervical mucus, or you note a reading of estrogen in the urine, that would mark the beginning of your fertile window, and couples again would abstain from intercourse during that period up until 3 days after the peak day.
Okay, very good. So I want to move on to the final method that has to do with fertility signs or observations, and this is the 2-day method, and one of the ones that you, Dr. Jennings, were involved in developing and researching.
Yes, indeed. And we're very grateful for all the research that went on before what we did, because this is something, I think that's true of all good research. It builds on other research. So that's exactly what we did in developing the 2-day method. We basically took a very large data set from the World Health Organization in the development of this method of women who were actually using the ovulation method in order to develop this. And the algorithm that you see, or the little graphic that you see here on the screen, basically tells you what the woman needs to ask herself every day in order to identify whether she should consider herself fertile that day. She should say, did I have any secretions today? If the answer is yes, today is a day that she could potentially become pregnant. If the answer is no, I did not see any secretions today, then the question becomes, did I note any secretions yesterday? And if the answer to that question is yes, then again, she should consider herself potentially fertile that day. So if she did not see any secretions today, and she did not see any yesterday, then today pregnancy is extremely unlikely for all of the reasons that Dr. Duane has just been describing. Because in order for her to become pregnant, she needs a sperm, an egg, and fertile secretions. If there are no fertile secretions today or yesterday, the likelihood of pregnancy is practically zero. So that's basically what this is based on. And in the development of this, of course, we once again, thinking of ease of use, we have developed at the Institute for Reproductive Health, we have developed a little very simple chart that's downloadable that people can use to track this on. But as you can imagine, there are many ways to track one's secretions. One doesn't have to use a downloadable chart. You can do a number of other things. And very exciting, I think, is the advent of this 2-day method app that we're very excited about, that I think a number of women are beginning to use on a smartphone. So essentially, when a woman uses this method, she just simply downloads this app, and I believe you're going to give information about resources.
Yeah, mentioning apps a little bit further. One thing I did want to ask you about the 2-day. So if a woman is using the method, how easy is it for her to determine secretions, have you found in your research?
Well, because of we were able to be confident that she would be able to determine secretions based on the good research that's been done on the ovulation method prior to our having developed this. But in fact, we found in our own research as well that women are very aware of their secretions. They just didn't know what they were.
So once they're educated about what it
Exactly.
is, then
Exactly.
they can identify them.
Exactly. And there are various methods of various approaches to identifying them, just the feeling of wetness, perhaps wetness in the underwear, the vulva, whatever. I mean, whatever is right for her, whatever works for her, is the way that she's going to detect secretions. But almost invariably, if you ask a woman if she is aware that she has some kind of secretions at some point during her menstrual cycle, she says yes. Women are aware of this.
Here, the app just shows that a woman needs to answer the question yes or no, and then whether she had her period. So it seems like it's
Right.
also fairly easy to use on a
Right.
daily basis.
I think that's the whole purpose of the app as well, so that it does just offer another avenue for using the method to people. And again, you're going to give information about the resources
Right.
for how someone could get this.
So those were the methods that a woman uses when she's observing fertility signs, whether it's secretions or whether it's a basal body temperature. The final method that we'll cover today is the standard days method, and this uses a different way to determine when a woman is fertile. And Dr. Jennings, again, this is one of the methods that you were
Right.
the lead on in developing.
Yes, indeed. Yes, this is certainly something that we've been working on at the Institute for Reproductive Health for quite some time. The standard days method is essentially it's a menstrual tracking method. In the sense that the only data point that a woman needs to be able to use this method is the first day of her period. The method is appropriate for women whose cycles are usually between 26 and 32 days long, and roughly 80% of cycles are in this range. So to use this method, the woman uses one of the cycle beads tools, and here I think you're showing one that is
This is
a
just
bit
a general
generic.
schematic, yes, just
right.
showing
Just showing what they would all look like.
Yes.
To track her cycles. When she's using that physical set of cycle beads that many people are familiar with, there's a rubber ring that she moves along the strand of color-coded beads every day. In the figure here, you can see that a red bead marks day 1, the first day of her period, and she moves the rubber ring to the red bead on that first day that she gets her period. Then she moves the ring 1 bead forward each day in the direction of that arrow. And when she's on a colored bead, the chance of pregnancy is very slim. And when she's on white beads, this is the time when she is at risk of becoming pregnant, when pregnancy is possible. And there's also something that you might call a monitor bead that is dark or a different color that's used for the woman. You can see it again here circled on this graphic. That's of a different color so that a woman can make sure that her cycles are at least 26 days long.
No, I have a graphic here of what the physical cycle beads
Correct.
look like. And then to prevent pregnancy, a woman then, again, like the other methods, would abstain or use a condom during
Yes.
the days that are marked fertile.
That is correct. And days 8 through 19 of her cycle are the days that are considered fertile for the woman who's using the standard days method.
So that is a pretty simple explanation, and for this particular one, I think a healthcare provider could explain it in a relative short amount of time and not necessarily need to send the patient elsewhere to
Correct.
Get more information.
Yeah, I could certainly educate a patient about this method in a 10 or 15-minute office visit, and it's wonderful to have the cycle beads because it's a nice visual for patients to be able to take with them. So it's a great method, again, for women that have regular cycles to easily understand and monitor when they may or may not be fertile.
So that covers the 5 methods that we know have quite a history of research and well-designed studies behind them. Now, I did want to touch on the efficacy of these methods because that was a point that we talked about earlier that maybe deters people, or the perception of efficacy might deter someone from using this as a birth control method. So they're all listed here. They are all very effective with correct use, 95 and over. Of course, with typical use, it does go down a bit, and maybe Dr. Jennings or Dr. Duane, you might want to speak to these efficacy rates?
First of all, I would like to just say that the difference between the efficacy with correct use and the efficacy with typical use is something that is often very misunderstood. So typical use doesn't mean the way you personally would typically use it. It's the way that women in a large population of people who are using this method might use this method, which would mean that sometimes she might misperceive the presence or absence of secretions. Sometimes she might forget to take her temperature. Sometimes she might say, oh well, and that she and her partner might have unprotected sex even though they know that they're on a fertile day.
So you're saying motivation might play a
Motivation,
part.
circumstances, context, just the things that are going on in your life. The same reason that sometimes you can't remember what you had for dinner last night, you might forget to do something like take your temperature in the morning. If you have a crying child or something you have to get up and do quickly or whatever might happen. So it's important to think about what we mean by correct use and typical use. And some women and their partners are more motivated than others, and some just have a better focus on this sort of thing than others do. So it's really important to think about that. Now on this screen, and I think there are lots, one could debate this. One could say, well, I saw a study, and indeed there have been a variety of studies that show a variety of things related to efficacy, and we could debate them endlessly. But this is an approach that is fairly commonly used by health providers, at least here in the U.S., that comes from contraceptive technology or that is based on that. So let's just focus on that for a minute, just think about that, and just say that it seems that the more, I will use the word complicated, and I don't mean that in a negative sense, but the more involved, the more things you have to do to use a method, the lower the typical use efficacy is, because it's just a little harder to use.
Now, in that case, would you say practice improves? So if someone is...
Absolutely it does. In most of the efficacy trials that I have seen of these kinds of methods, as well as any other family planning method, by the way, most of the pregnancies take place during the first 3 to 5 cycles of use. Because people just haven't incorporated whatever it is they're supposed to do into their lives sufficiently.
So you're saying this for all contraceptive methods, so it could run from condom to pill to
exactly.
natural methods?
Think about pills for a moment. People, it takes a while to get into the routine of remembering to take a pill every day. And besides that, it's during those first few cycles that many women notice a side effect and they say, I'm not doing this. So they simply stop and a pregnancy occurs. So there are a variety of reasons why during those first cycles that pregnancy rates or that failure rates are a bit higher. But
then past that point...
they tend to be lower. The failure rates tend to be much lower.
And I'd like to make a few points about the effectiveness. I think what Dr. Jennings highlights is really important. These methods require patients to change their behavior, to modify their behavior, to make observations, to make conscious decisions whether and when to have sexual relations. As such, methods that require behavioral modification, whether they're natural or fertility awareness-based methods or artificial methods like the pill or the condom, the effectiveness rates are about the same if you look at it from a correct use perspective as well as a typical use perspective. The other thing that I want to highlight, and we touched on this earlier, is part of why these methods are not well received is because of the misinformation. And ACOG, the American College of Obstetricians and Gynecologists, also continue to perpetuate misinformation that these methods are only 75% effective. That statistic has been disproven. Part of the challenge with that statistic is they combine all natural methods, whether it's an actual natural method or somebody saying, I can tell when I'm fertile based on the cycle of the moon. That's not an evidence-based method. If you look at the individual evidence-based methods, the standard days method, the Sympto-Thermal Method, the ovulation-based methods, the 2-day methods, these have good scientific research to support their use. With facts, we actually did a review of all of the research that's been done since 1980, and we've published the effectiveness rates, both typical and correct use effectiveness rates. All of these methods have correct use rates that are comparable and typical use rates or effectiveness rates that are comparable or even better than the pill or the condom. So these methods can be used very effectively. Again, it depends on motivation, how motivated a couple is to avoid a pregnancy, or for the couple that may be like, you know what, yeah, we don't necessarily want to have a baby now, but it wouldn't be a worst case in 6 months from now. They may not be as committed as the couple that says, we're done. We have our 3 children, and so they may be a little bit better because they may be a little bit more motivated at avoiding pregnancy. The key point, these methods are effective. Effectiveness does depend on how well couples learn how to use the method as well as how motivated they are to use these methods correctly.
Okay, well, those are all very good points to keep in mind with these methods. What I would like to talk about that we've mentioned earlier are the different tools that are now available for women to use. All of these, or most of these methods, here on the left-hand side you can see charting apps. So for iPhone and Android, there have been a number of apps for implementing this Sympto-Thermal Method in particular. And Dr. Duane, I know that you are doing a review of these kinds of apps and which apps actually employ the Sympto-Thermal Method.
Right.
So
well,
could you tell us where you are with this research?
Sure, absolutely. The FACS organization is conducting a review of all of the evidence, of all of the fertility apps that are out there. There are close to 100 apps out there that purport to help couples avoid pregnancy by charting their fertility. What we've discovered is many of these are not based on the solid scientific evidence supporting these methods. Mm-hmm. So with FACS, we've developed a rating system. We are training reviewers to evaluate each of these apps because what we want, and I'll be honest, I've got great concern about a number of these apps because if they're not actually helping couples identify the fertility window based on the evidence, people may have an unintended pregnancy. They're not going to necessarily blame the app. They're going to blame, oh, it's the natural methods don't work. So FACS is going to be conducting a review of the apps that are out there and coming out with recommendations as to which apps we would recommend couples use to chart their fertility. At this point, when people ask me, because there are so many apps out there, if people ask me, since we haven't completed this review, I refer them to apps that have been developed by the organizations that have actually developed and done the research. So for instance, or teach an evidence-based method. So for instance, the apps developed by Cycle Technologies, or the app that was developed by SymptoPro that teaches an evidence-based Sympto-Thermal Method. Many of the apps out there are really period trackers or calendar apps and are not based on evidence-based methods. So I would say it's a buyer beware situation at this point. I wouldn't necessarily recommend choosing an app based on how pretty it looks or how many downloads it has, and I would encourage people to stay tuned to the FACS website, factsaboutfertility.org, because I hope within the next 3 to 6 months we'll be able to come out with an objective, evidence-based review of the apps.
Well, we'll look forward to seeing that and being able to know which ones are based on best evidence.
I agree. That is very exciting. And I think there is a tendency to say, oh, I like the look of this app. Or, oh, this one asked me some really cool questions and gave me some great feedback. And honestly, I think it's a little bit frightening. That people are going to be using these and then having an unplanned pregnancy, and that could be obviously that's not what any of us want.
Right.
I do notice on these apps, and I just wanted to mention because I had said before that there was a 2-Day Method app, and I believe we showed it a little bit earlier.
Yes, we did.
So I did want to be sure that people knew that in addition to the ones that are here, that there is the 2-Day Method app. I'm glad you didn't clutter the screen with too many, but there we are.
There we are. Well, there's another interesting development that has come out lately, which are thermometers that sync with the charting app. And I think that the intention is that people do want to make sure that the information is accurate and so on. But I think to Dr. Duane's point, it's about how that information is then translated through the app. So
that's really designed to facilitate and just make it easier so a woman doesn't have to check her temperature and then enter it into her phone and perhaps enter it incorrectly. She could just sync in, it would automatically. So it facilitates the use of the method, which if it's easier to use the method, as Dr. Jennings pointed out, more people are likely to use it effectively.
So I would like to mention that in addition to the phone apps or smartphone apps, there are some web services out there as well. So some women do like to have something that's accessible through Wi-Fi, so they can access it through their computer, through their phone, a device with an internet connection. I would like to mention to the audience that there are a number of resources on the methods that we've been talking about. And I will be sending out, again, a series of links that have detailed information about what Dr. Duane and Dr. Jennings have been speaking of. There is the Taking Charge of Your Fertility, which has been giving women also good information about what's happening in with their body during their fertile cycle. Contraceptive technology is a resource for descriptions and also for efficacy rates. There is an online training, which Dr. Duane has one through her fax, and there is one for the Standard Days Method that's online. Again, we'll be sending that link. If you have any questions for us about this webinar or any of the information that you might want to know more about, you can contact us directly at providers@cyclebeads.com.
And I did want to say that FACS, as you mentioned, has developed a education presentation that is approved for CME credit as well as CEU credit. We have about 20 trained speakers who are available to deliver that presentation live. And as you noted, we are in the process of developing it as an online electronic presentation as well. It's similar to this presentation, although we go much deeper into the science behind these methods, as well as how they can be used to help couples achieve pregnancy. So you
that's
can
good
certainly
to know,
find that information on the website.
I do have people inquire about these CEUs, the continuing
Yes,
education
and we've got
credits.
speakers all across the country, from New York to Colorado to Texas to Florida. So,
well, that's very good to know. So let's just check to see if anyone has had questions. We did have someone ask, and Dr. Duane, I know you've mentioned this before, where can you send a patient who's interested in?
that's an excellent question. On our website, factsaboutfertility.org, we have patient education handouts about each of the methods. So if they just first want to explore which methods might work for them, it gives information about each of the evidence-based methods, as well as links to vetted teaching organizations. So we link to the Institute for Reproductive Health. We link to the Billings Ovulation Method teaching website. You can find that information on the FACS website, factsaboutfertility.org, where you can find links to teachers for each of the different evidence-based methods.
And, you know, something that I've seen with some of the providers that contact us is that just to give patients an idea of the range of methods, I've seen things like birth control boards that are hung in the waiting rooms or in the consultation rooms. So they'll have, you know, the pill, diaphragm, cycle beads, and other information that the patient can just look at while either while they're waiting or while they're being counseled. And I think that's a good idea, or at least, you know, a quick way to put in the mind of a patient that there are different ways of
right, and we're starting to see the natural methods being advertised to the cycle beads, but unfortunately, many times family planning options are not being included.
Right. That is very, very true. I think that I would just like to make two comments on that. One is that quite often fertility awareness methods are either not represented at all or they are misrepresented.
Absolutely.
And that is a big problem and one that we try to address, but it is a very ingrained and difficult to address topic. So it's something that we all struggle with, and I'm really grateful that people have joined this webinar in an attempt to learn more about this. I think it's very, very important. But also when it comes to choice, I would like to add that I think what we can see from this presentation today is that we have a range of fertility awareness method options as well. It isn't just one thing. There really is something for everybody.
Absolutely.
Among the fertility awareness methods. And it's important, I think, for all of us to keep that in mind, that different people have different needs at different times. And this is a great way to introduce people to their fertility and help them learn throughout their lives.
We have a question here, and I know this comes up when you're talking about the various methods to patients. What kind of criteria do you use with the patient for screening for a method?
So what criteria do I use to help patients decide which method might be
Yes.
best for them? Well, I talk to them about, what their needs are, and some practical things too. I mean, first of all, are there teachers in the area that can teach a patient? If not in person, are there online teaching opportunities available? But, is this a person that has regular cycles and is looking for a simple method where she doesn't necessarily have to observe cervical mucus? Standard days is a great method. Is this somebody that, they like to know for sure and they want that double check? Then maybe Sympto-Thermal or Sympto-Hormonal might be good. For young women who, especially the adolescent population, where they're likely not using it for family planning, but just to better understand their cycle, I think the ovulation-based methods are both excellent. The Creighton model has developed a whole approach to women's health called naprotechnology that has health protocols for women that are dealing with potential women reproductive issues that may need to be addressed. That may be a good option for those women. So there's a number of factors that one needs to consider, but I think as Victoria pointed out, Dr. Jennings pointed out, is there is a method really for everyone. And the one method that we did not mention this entire time, and I'll mention it since this was, again, developed by Dr. Jennings Institute, is the lactational amenorrhea method, which I think is also an outstanding method. So there's so many methods out there. I think we need to encourage women, learn about them. And as healthcare professionals, I think it's incumbent upon us. FACS did a survey of the directors of women's health curriculum in residency programs, and the method that they were most familiar with is the rhythm method. Now, when the rhythm method was developed back in the 1920s, almost 100 years ago, it was based on the best science at the time.
At that time.
But science has evolved. And just as we don't treat infections as we did back in the 1920s in the pre-antibiotic era, pre-World War II, we shouldn't be recommending a method that's, when there are newer, better researched methods that allow a woman to prospectively identify when she's
I
fertile.
think that's a good point, too. I think in general, at least, and I've seen, and in media especially, and lately, is that these methods are called the rhythm method. So I think that there's a misperception about...
Very definitely. I think perception is really driving a lot of what we're talking about today. So I'm very excited that we've been able to have this webinar and look forward to continuing this conversation.
And I think the perception is changing, too, because now that women are interested in ecologically or environmentally friendly options, I think that's part of why fertility awareness-based methods are finally making a comeback, because women perceive, I eat healthy, I don't put hormones in my food, why should I put a hormone in my body? So I think if we can continue to educate our colleagues and make these options available to women, we're going to see a much wider adoption of fertility awareness-based methods, which ultimately I think is best for women.
Well, I have one more question that this one has come up before, which is there a difference, or what is the difference between a fertility awareness-based method and natural family planning? Are they interchangeable, Dr. Jennings?
I think it's more of a political issue than it is a reality. The methods that we have been talking about are, in some contexts, are promoted and taught as methods that would require abstinence during the fertile time, and in other contexts as one in which people could use a barrier method during the fertile time. So that's really the difference.
Right.
But I think it's a matter of perception and politics.
Yeah, I think the term natural family planning and fertility awareness-based methods can be used interchangeably. I think natural emphasizes these are natural, there's no hormones, and they can be used for family planning. Whereas I mentioned fertility awareness-based methods emphasizes it goes beyond family planning in terms of monitoring health. When I talk with patients, if patients are going to use them in combination with a barrier method such as a condom, I tend to refer to it as a fertility awareness combined method, because I think it's important to note that when a woman is using, or a couple is using a condom during their fertile window, they know they're fertile, and so they're adopting the effectiveness rates of the condom. So in fact, effectiveness might be slightly lower because the condom's typical use effectiveness rate is lower than almost all of the natural methods. So I think it's just important for women to understand that and for a couple to make that decision. So I use the terms NFP and fertility awareness-based methods interchangeably, And when I refer to using them in combination with barriers, I refer to that as a fertility awareness combined approach. Because in fact, you're using two methods. You're using knowledge of fertility plus another method.
Okay. Well, thank you very much for that clarification. I do know that that all those terms are thrown around, but essentially we're talking about the same
Same thing.
methods. Well, I've been very grateful to you both for joining me today to talk about fertility awareness-based methods and for clarifying and for giving us so many details. To our audience, thank you for joining us. And again, if you have questions, please contact us at any of the places here on the screen. Email, Twitter, Facebook. We're available at all of those. And again, I will be sending out a list of resources to the attendees. And thank you very much, and look for our next webinars. Bye-bye.